Good day everyone, my name is Christine Bayan, and today I will be performing a return demonstration on the assessment of the musculoskeletal system. So before we start, we're going to close the door and the curtains to ensure my patient's privacy and of course perform hand hygiene. So now I'm going to introduce myself to my patient to verify her identity and of course to explain to her the procedure that I'm about to do. Good day ma'am, my name is Christine Brian, your nurse student for today. May I know your name and your birthday ma'am?
Danis Gonzalez,
Birthday po?
March 14, 2003.
So before we start, can I ask you a few questions ma'am? Do you feel any pain in your body ma'am? None. Okay ma'am, let's proceed. Inspect the upper extremities, observe for skin color, presence of lesion, rashes, and muscle mass. And palpate for skin temperature, texture, and presence of masses. So ma'am, can you please stand up? And so now, ask the patient to extend arms forward and then rapidly turn palms up and down. So can you do that for me ma'am? So next, ask the patient to raise both arms to vertical position. Place hands behind the neck and place hand behind the back. So, can you do that for me again, ma'am? So, next, ask the patient to flex upper arm to resist examiner's opposing force. And instruct the patient to abduct the arms, adduct, and do internal and external rotation, one arm at a time. So next, bend and straighten the elbow. Inspect and palpate the hands, fingers, and wrists.
Hands.
And instruct the patient to extend and spread the fingers. Make a fist with thumb across the knuckles. Extend.
Spread. Make a S.
And palpate the radial and brachial pulses. And have the patient squeeze two of your fingers. As needed, assist the patient to a standing position and observe her range of motion. So now, ask the patient to stand straight with feet together, both eyes closed with arms outside, and wait for 20 seconds and observe for patient swaying and ability to maintain balance. So, We're going to examine the lower extremities. Inspect the legs and feet for color, lesions, varicositis, hair growth, nail growth, edema, and muscle mass. So now I'm going to palpate for pulses and skin temperature at the posterior tibial, dorsalis pedis, and popliteal areas. And instruct the patient to spread and wriggle the toes. So now stroke the sole of the patient's foot with the end of a reflex hammer handle or other hard object such as a key. Repeat and repeat on the other side. And lastly, perform hand hygiene. And document all your findings. So that's how we assess the musculoskeletal system.